All right, good afternoon or good morning, depending upon where you're joining us from. We'll get started in about 45 to 60 seconds. For those of you already in the room, feel free to drop your name, location in the chat. Let us know where you're beaming in from. Appreciate you joining us. Love to see the location of folks trickling in. Just like really nice to see across the country, communities everywhere. Hope everyone's doing well. Okay, so we'll go ahead and get started. Again, good afternoon, good morning. My name is Jeremy Adderman. I'm a senior director at the National Council for Mental Wellbeing. Very excited for today's webinar. This is the third webinar in our webinar series around artificial intelligence. If you missed the first two, we did one on sort of policy and programmatic implementation considerations. The second one on data security in the context of AI. Those are on our website. Feel free to check those out. But this webinar in particular is a really important one. Uh, we know that many folks on the line here, that community mental health providers across the country, behavioral health providers across the country, are either actively using or exploring the use of or considering the use of AI tools, and you sort of have to at this point. You'll be left behind if not. And so, but that being said, it's a daunting journey. It can be a little overwhelming, it can be a little scary, as can any sort of technology adoption be. So we thought it important to bring on two folks who have led their organizations through some of this journey, and just sort of talk about the lessons learned, the good, the bad, the up, the down type of stuff. So again, appreciate you all joining us today and excited for today's webinar. Before I have the panelists introduce themselves, some quick housekeeping. Yes, this webinar is being recorded, and yes, it will be available on the National Council's website. We won't have any slides today. The chat box is, of course, open as you see folks putting in their location and whatnot, so you can use that for any comments and things like that. If you have questions for the panelists, try and use the Q&A chat function. It's just a little easier for me as the moderator to watch that one, but I'll also keep an eye on the chat function as well. And with that, I think we can go ahead and get started. So, Nikki, would you first start us off with an introduction?
Sure. I'm Nikki Stenitis. I'm the Chief Clinical Officer at New Vista. And New Vista is a community mental health center and CCBHC, covering the central counties of Kentucky. And so it's a 17 county region that we are behavioral health, all things. We're kind of the full continuum, crisis to residential, and serve 20,000 people roughly each year. And we're about an organization that has about 2,000 staff.
Wonderful, thank you. And Jim?
Hi, I'm Jim Martin. I'm with Community Services Group. My role is Chief of Clinical Innovation, and I've been with CSG for about 16 years. We're a company of about 1,400 employees working in 19 counties across central Pennsylvania. And we provide mental health services, residential mental health treatment services, and also intellectual developmental disability services.
Great, thank you both so much. Well, one of my first questions is about sort of motivation and sort of where your AI journey started. But maybe what we can do actually, let's give folks a sense of where you're currently at, so we can then do before and sort of talk about that just so they know. So, Jim, why don't you go ahead and start? Can you just give us a quick overview of where your organization is currently at with its adoption of AI technology?
Sure. We have adopted a system that we're using in a number of our clinical and treatment programs to assist with documentation. We've been operating that for going on 2 years now. We do have, and earlier on we adopted an AI governance policy that we are using for kind of all of our AI efforts, because we also have, we're a company that uses Google as our corporate system. So we use Google Gemini, and that's something that's available as well. So as we kind of got into it, and as more and more products have begun offering AI assisted features, we implemented that policy. So it's we're not fully in the AI world, but certainly everybody's touching it in some way or another.
Great, thank you. Nikki, how about you?
So for us, we similarly we have a documentation tool, clinical documentation tool that we implemented earlier in our journey. We implemented it in May. We had been utilizing Copilot is what we use as far as like a kind of more neutral, not clinical oriented tool. And then we are in the process right now of adopting a AI compliance tool. So we are set to have that kind of go live in January. So we are in the journey and we're continuing to grow. So I would say on the AI side of things, especially in the last year, we've changed pretty significantly.
That's wonderful. Thank you. Thanks both. So we have that baseline for folks, but let's then go back to the sort of origin story here. Curious, what motivated you, your leadership teams, your organizations to explore artificial intelligence tools like you all have today? I'm curious, was there a specific pain point or pain points, or was it more a swirl of things? So, Nikki, you want to start?
Sure. I mean, I think we all know in our world, clinical documentation at all is just excessive. It's something that in our world, it's always been true that if you were working for a private entity versus a community mental health center, the amount of documentation is just significantly more. And I think that was compounded when we became a CCBHC, just additional elements there. So it was something on our minds. And I think we've been hearing about AI and like things that were happening in the world. And so for us, our first step to even dip our toe in the water was our EHR vendor was offering a product, and we essentially were thinking, okay, this is a low-hanging fruit. Let's do a quick pilot, see what this is like. And truly was pretty disappointed and kind of felt for a minute like this journey's too soon. AI is not where it needs to be. It's not what we really want to do. And so I know for me, going on that journey and kind of having a false start, I was like, okay, this is not the time. And probably about 3 to 6 months later, my boss at the time had come back from a conference, and she was like, there's another vendor. I feel like we need to look. We need to start exploring larger what other options are out there." And I would say for myself, it was a little bit of like okay, I'm going to do this because my boss told me to do it, and so I'm going to look at it. But I'm not like I wasn't impressed before, and really that kind of spearheaded a journey where we just started with a demo. And then we had a conversation, and then we brought more people in the room, and it was one step at a time is really how we approached it. It was like, we're not saying we're doing this, we're not saying we're not, but I'm exploring the options, and that journey just led us to continue down until we were actually adopting it. It didn't probably overall, it was probably a little less than a year from the time which we first had our conversation to where we were fully implemented. It felt like a very organic process, but it was because my boss told me to do it, and so I did it.
It's
Now today, I'm very happy I did, but
a good
that's where
reason
it
to
took
do
us.
anything, something, what's interesting though, and again, I think folks on the line understand this, and we talk about it, and you all live it every day, the documentation piece. Like it's so burdensome. And I think in our field, given the nature of how a lot of services are delivered, whether it's talk therapy or whether it's the assessments and sort of how burdensome they can be. Um, it's I think it's not surprising that what we've seen in AI and behavioral health, like as we look at technologies and vendors in the space, that the documentation space was the first place that a lot of folks went to, and it's also the area in which we're seeing the largest uptake. It's so sort of acutely needed, and it's such an acute pain point. So it's great to hear that you all were not dissuaded from a early misstep because it is such a big issue. Jim, how about for y'all?
We came at it from a slightly different, I think, starting point. But for us, we had struggled with all of those same issues that you and Nikki have addressed. And I think we were continuing to just seek out ways that we could lighten the load on it was primarily, we started with the outpatient mental health therapists. We came across the product that we're using now, and we looked at it as a way for us to finally take something off of the therapists, not only to help them feel more job satisfaction, more engagement, hopefully impact retention, and also eventually become perhaps a recruiting tool for new clinicians. But then the kind of complement to that too is also giving our consumers just more time and more attention, so to speak, from those clinicians who maybe weren't having to be so distracted with the documentation.
Yeah. Well, and that's again, there is, I think we're at a tipping point, it seems, where um, the documentation piece has been the largest space of a use case, I should say, in behavioral health to date around AI technologies. And I think there's still a lot of folks perhaps that might still find value in doing so. But I think from here, then we're going to end up seeing some branching, right? So Nikki, you mentioned compliance, which is a really interesting space. There are folks who are looking at revenue cycle management. There are folks that are looking at workforce training. So I think we're probably going to start to see a lot more use cases come out. And from there, I think it'll be really interesting to think about how organizations evaluate where they want to place their chips, right? Like, what is the most important piece for you? So again, in the early days for both of you, I think documentation, again, it was so acute of a need, and that was where the majority of solutions were at. But let's just dig in a little bit more around this like journey you all went to from when you sort of said like let's dig in, or let's dig in again, Nikki, to like today. Are there other missteps that you all felt you had in either evaluating vendors or evaluating need, evaluating a tech integration with other technologies you might be using? So tell me a little bit more about that like process and maybe any early lessons learned. Jim, maybe you want to start?
Yeah, I can talk about now. This was not. We were very fortunate with our AI partner. The first time that went well. We have had missteps in the past, like any organization has with technology or other clinical tools. I think for us, we have sometimes, if we have not done our kind of work in the change management side, preparing people to understand the larger, what is the goal behind this change. It is not just change for the sake of change. And I think that's a big area where leadership can have get all excited about it and understand the why and the where we're going to go. But if we don't really explain and kind of educate and make people aware of where we're going, what the benefit is to them, what the benefit is to the consumers. Um, I think that's probably the main issue. There are other times, which again is probably common, but just the divided attention and energies where something is started and then another crisis, another project takes off, and before you know it, we've taken our eyes off of kind of what we've wanted to do, and we all know things kind of tend to drift back to the way they used to be. And if you're not on top of it, that sometimes for us anyway has been a challenge. Um, I I can say one thing, kind of a lesson I think that we've learned over the years, and one that was particularly successful for us with the AI documentation tool that we're discussing, was using and kind of taking advantage of an early adopter champion model. So rather than doing kind of a big bang full rollout of an implementation, we really utilize those employees who are the most innovative, the most interested, and the most willing to, because there is pain. There's always going to be pain and bumps, even in a great implementation. But they were much more willing and patient to kind of work through those. And then when they saw the benefits, then they were also kind of a second voice echoing and promoting the why that we were going to do these things. So
Yeah. Yeah, Jim, and I know there's some questions from folks about sort of what products are our panelists using. We'll get into that. I mean, we're not trying to hide anything, but also want to be respectful of a lot of great solutions out there. But we will talk a little bit more details about that. But one of the things that um, there is an AI company that we partner with called Elios. Their chief clinical officer over there, Denny Morrison, he says so well that a lot of these AI tools that we're seeing these days are built so specifically and uniquely for the workforce, and in this case, you're talking about documentation for the provider workforce, that you're the champion piece is what I'm getting at. I mean, you're starting to, I think when you get those folks who are implementing the technology and see the impact it has on their day-to-day life, that they're huge champions of it, right? It makes sense. You can sort of bring them in that way. Whereas I think other technologies in our space aren't always designed necessarily. They're designed to do very important roles and jobs, but it's not always designed to make that person's life like easier the way that some of these earlier technologies in AI are. And so from a champion perspective, I could see how both it would be important and then ideally, really valuable to get those champions on board. Nikki, how about for you all? And we're going to talk a little bit too about the human side of this, but anything else on sort of the early missteps and other lessons learned in those early days?
I mean, I think the big thing I think was probably one of the missteps that we probably avoided, which I think is in our journey. Like, so when after our first kind of failed AI exploration, it really was a pretty smooth process. And I think one thing that we as an executive team had kind of really talked about is the why, like the who we worked for was really like, why are you doing this? What's at the heart of what you're doing? And there is a way to look at something like clinical documentation as well, we want a return on investment. We expect to get more revenue. We're expecting more hours to be worked. Like that is not the approach. And it was one that was like, you can choose this approach. And we weren't cautioned against it. But as we talked as a team, we're like, that's not why we're doing this. Like we want the job is hard. It's gotten harder. Like since COVID, since just being community mental health, like the cases have gotten more acute, the demand has gotten higher. We really do want to create the environment that will, yes, like ultimately lead to the positive outcomes, but that's like a much lighter touch of what you're really looking at. If you're just looking at that, you're going to miss the overall goal, which is building that culture, that environment where people can thrive, where people want to be, where we can help people the most. And if you do that, other things will come. So we really, at the beginning point, really solidified ourselves as to like, we're not going to talk about how many more hours of productivity, how much do we want for generating revenue? We want to focus on what does this do for the people sitting in the seats, both as the staff and as for the client sitting across the way. So that I think was a misstep we could have avoided because I do feel like going down the journey in that vein, even though I do feel like that will naturally come, that's not the way to do it. It's too surface level. You want to get down to your core. The other thing I'll say is during this change, we implemented as part of a larger change process. We were going through a kind of shift in how we did open access, same day, next day model of care. And this was one of the steps along that journey to help kind of speed up like the time to allow for just an easier way to do intakes in this open access model. And so we timed it. When we were communicating it, it was a really complex thing to communicate. And we over communicated it. Like and I think what also helped is, as Jim talks about the right people being part of the process.
Hmm.
The team leader was somebody who was a clinician previously and had done documentation for our organization before. And so she drove the ship and she went to every single meeting. She pulled our teams together. She helped make sure she had lots of different people. So I think that helped when the change happened. The messaging was happening in their local staff meetings. It was happening in our large leadership meetings. It was happening in that way. And then probably contrasting to what Jim did, we did do doors open. So we did a full week and a half of training. No, it was a full week of training. And then we did a virtual the following for anyone who couldn't attend. It was in person. Our vendor came out and did an amazing training for all of us. And essentially during that training, you went live with it. You kind of learned it and you did it at the same time. So people were leaving the training with it in their pockets. And I think because that training was so well designed, because we had over communicated it and everyone came out and how it was all done, that kind of yesterday we didn't have it, today we all have it, worked for us. And I think that would have only worked with all of those steps kind of leading up to it on that journey. And so for us, it was a kind of part of a larger piece of the pie for us.
That's great. I love that we're getting two different perspectives here. Jim, did you want to jump in with something?
Well, I was just going to say, I did not, that's a great point, Nikki. And I was not implying that that was the only way to do it. I think it was kind of for us at that particular time and maybe for the amount of just some of those factors, I think it worked out better for us, but certainly there's benefit to the way you're describing as well.
But yeah, I love that. And I mean, no two organizations are going to be alike. I think you all will best understand your staff. One piece, we're going to get to the human side of this, and Nikki, you and Jim, you both already started to allude it with the champion pieces and sort of the communication pieces. But just Nikki, one piece that you spoke to around your a lot tying this rollout with your shift in the open access, same day access piece. And that's a really interesting thing. We might not get too much into it, but it is perhaps something for the audience to think about is, these technologies have the opportunity to create efficiencies that will end up impacting other spaces in the organization for the betterment, we would hope. Now, Nikki brought up, productivity, you can look at it that way, but another way to look at it is just what does it mean for other elements of how you deliver care or how you do business? So something for perhaps for our audience to take away here is that don't look too much in isolation about the use case and the pain point, but think about it, sort of almost like system level. What is this going to mean for the entirety of how we, operate as a provider? Jim or Nikki, anything to add to that?
I think it's a great point. I think if you've been to, obviously the national conference or any other conferences and you've seen the technology out there, it's coming no matter where it is, whether it's in, the revenue, whether it's in documentation or even embedded in a partner product that you're probably already using. So I think it helps people get used to the idea. And I can say for sure that the 2.5 years ago when we began talking about this, the reception from people is so much different than it is today, because so much it's changed so much in our culture already and has become so much more comfortable and accepted. So I think in that sense it's just a good kind of a cultural shift for organizations and for the staff as well.
Yeah. And
Yeah.
so, oh, go ahead, Nikki.
The only thing I'd add and I think what's cool from our perspective is that, the open access model, this kind of like that, it was also something we worked with a vendor to do, and it's been developed forever ago. It's not a new thing, right? It's been like probably decades that it's been around. You can apply new tools to
Mm,
old processes. Even like they obviously have made it, reinvigorated, but I do think like as you bring in these different opportunities, you can change the way you look at methodologies or things you're trying to implement as a team. And so for us, it really allowed it to take off and offer something that, even a year ago we weren't offering, and made the process much more organic. So I do think there's something to be said for new things and old things coming together to help make it that much more better.
I love that. So let's go back to the people at this. You both spoke about communication and champions here, and I do think, Nikki, you were talking about communication in the context of what this doesn't mean. Like this doesn't mean now you're expected to do X more work or things like that. And if we just like zoom out a little bit to like AI can be a very everything from like confusing to like scary topic, to be honest, right? And what it means for society, but even as individuals and as professionals. Like does this mean I'm losing my job? Am I being like shifted out? And of course, again, we all read the headlines. We know that some of this stuff is actually happening. But I think in behavioral health, and National Council has done a lot of webinars on this. We've had a lot of speakers speak to this. I don't think that's ever going to be the case for our field. It's just not the nature of community mental health provider organizations. It's not the nature of our workforce situation. But what it does mean is like tools to empower our staff. It's tools to make the lives easier for proper work-life balance, things like that. So I know those are things that, at least at the National Council, we've spoken to quite a bit. But I imagine that's really important to communicate that. And so let's talk about this like human side of adoption. Again, the fears that came up, the skepticism. Another big one around AI adoption is like data and security. Like I'm really concerned about what this means for my clients and their privacy and things like that. So can you all just sort of expand on like what was that like for you all to help move your staff from the hesitation to the like I can't imagine working without this kind of space. Um, Jim, you want to start?
Yeah, I'll mention something that I think we say and have said throughout this process, which is that AI is a tool to help us. It's not to replace us. And most importantly, kind of in our guidelines, as you said, this does not take the place of clinical or individual personal judgment. I mean, that's what we absolutely need people to continue to do. It's really just to help make things more efficient, give us time to do the things we really want to do versus the things that maybe we don't want to do or have to do. Um, I'll say one more thing, and then Nikki, you can jump in because I think there's a lot to this. Um, I think it goes back to us promoting the why that we were doing this. The why was giving you more time, more attention, better care delivery to the individuals. Because again, we started in that direct care, outpatient documentation realm. making sure people understood that this was a tool that we were beginning with. It was as I said, we used the champions model. We made sure that our consumers were informed about it, that was a discussion that they had with their care provider about whether they wanted to use it or not. And there are some people that still said, I don't want that used. Our particular product, there isn't a recording or a storing of data, so we were able to assure people, both staff and consumers, that was not a concern or a worry for them. And you hit the nail on the head. I mean, when we look at the surveys and the feedback from staff, that they're upset if for some reason it doesn't work, or if they're not able to. I mean, it's something they've come to rely on and really value. So I'll pause, Nikki, if you want to jump in.
No, I think, one thing that was said to us when we were going through this journey was, clinicians, it's like if you're at the documentation piece is like teaching a fish to climb a tree. Like documentation is not why people do this. It's really like what your skill set is, what you're good at is like that interaction, that engagement, that getting people to talk, getting people to open up. And doesn't translate often to like really great documentation. And so what they're really trying to do, and what we were trying to do with all these different tools, whether that is the documentation piece or even just more general like Copilot, things like that, is take that part out of the equation, let you do you better. Right. And so the concern whenever there's issues where it comes up, obviously, about the idea that there's a concern for replacement. And I don't buy that. I really do feel like what it allows is the humanity to be enhanced, and allows to take away the busy work that like is nobody's favorite thing. If it's your favorite thing, you're doing the wrong job. So that's just what the reality of is being clinical and in this realm. I do think some of the things we got as feedback, like generally, again, this was more recent, so I feel like we also got the benefit of people playing around with AI and kind of seeing where things are. So there was a general interest, but some of the things that we heard as like some concerns, one was about storage, like what if the storage piece, right? We intentionally really did a lot of work when we determined what vendor we wanted to use to see like what happens here. And for the way that our product works, it generates it, but there's no recording. So there's no recording to hack because it doesn't exist. And so they talked about like how it works as like a printer. Things go in, you print out, but there's nothing once it's out. What's out is out. That's it. And so it was helpful to know a little bit how their storage, their HIPAA compliance, their safety features. Like we went really into a realm and pulled in our IT team to really look at how that was being managed so we could answer that, because that's always one concern. The other interesting feedback that came up was this is something that clinical people need to learn to do. Like this is like you're taking away something that they should learn to do. And I think that there's a lot of different ways to think about that, but I liken that kind of idea for when you move from paper charts to EHR, right? Like you could say that all these values of the paper, it's quicker, it's easier, we can get the signatures right away, we can sit down and open a file, but when you move to an EHR, you lose some of the pieces that come there, or even from like the computer and the typewriter. Like this is part of that process of what does it mean to be a clinician? And to me, and the way that I kind of talked about it is like to be a clinician, to be a case manager, to be a care coordinator, all of these things are about that human connection, and this is just the side thing. So like however you want to use this, however this can help, we want that, but it doesn't change the core of what you're doing. But it is interesting, some of the different feedback of how people felt along that way.
Yeah. 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 I love that. I love that printer analogy. That's really great. And, I we give, I think I mentioned to you both, I gave a presentation earlier this week and to a room of probably 100 folks. And we asked, how many of you in your personal lives have ever used any of the AI, that's a ChatGPT, Claude, Gemini, all those things. And it was like 98% of people have like that, right? So I think yes, like we're all a little more exposed than we were a year ago, certainly 2 years ago, right? Like there's probably no one that isn't like even aware of what these things can do on a surface level. But I love that you all focused, you and your vendor partner focused on the education around how do these things work. It's one thing to understand what is a large language model and define it, but it's another thing just to say, like, this is how the tool works. I understand that. I can ask the right questions to the vendor. I can also explain it to my patient when they ask me, my client, when they ask me the questions about these things. And so I think empowering our staff with that kind of knowledge, not deep technical knowledge, but sort of the like understanding concept knowledge, is really important here. So I'm glad you did that. Let's talk a little bit about that like vendor journey as well. And again, feel free to tell the folks because I know some folks are interested who you're working with. But um, can you help us understand maybe how did you come to identify the vendor partners that you're working with today, and what was that process like? Were there certain I don't know, must-haves, but there were certain sticky points that you said, this is a really important thing for us, or that you learned throughout the process as this is a really important thing that others should be thinking about. So Nikki, you want to start?
Sure. So for us, once we kind of started on the journey, the entity we started to look at was Elios. And so what I noticed from the beginning really had to do from their mission, I guess, the way that they approach things is very different than a lot of vendors I'd worked with before, which is very salesy. Like I've gotten the salesy, like you get the 100 email, like calls, emails, like I'm used to that. And their approach was different, which helped because it didn't immediately make me want to turn off. Like it was just a very like just a check-in at your pace, so I feel like early on we were lucky in that we kind of had a really good team that was really willing to go toe to toe. And that included like I think a lot of the most important pieces, they came out, they did presentations, they worked with our teams, they were really great about that process. And that allowed us to open the door more and more. References, I think, are really important. And so we did ask them for a couple references that we spoke with really openly and had a really overwhelmingly positive response. But during that time frame, there were some changes with the previous vendor that we like had the pilot with and it didn't work out. And we were really kind of going down a path up to the point where we're looking at potentially contracts. And then all of a sudden it was like, do you know that, this is our EHR. Maybe they have all the stuff that they didn't have before. And so it did make us pause in our process and do some soul searching about like what's new, what's going on. And in that process and talking to our contact at Elios, one of the things that I was honest. I mean, I think where it was helpful was we had a very honest back and forth about where we were. And I said, I got to be real. Like we need to do our due diligence and we got to check out this product again. And one thing that came from that was someone in that world that she was working with was in our same boat. And she said, yep, I've heard this is true, and this is true for someone else, and they're talking to us. And so, I know this is common. And I asked, could I talk to that person with like that contact you're talking about who hasn't decided on Elios, who's in the same boat I'm in? Can I talk to them? And she was like, I'll ask, I'll connect you. And so what was great from the beginning was I was able to talk to people who both were using Elios as a product and then those that were in my boat with me and had a really helpful conversation talking through both our sides of like what has happened. So I do think this right here, this webinar and having these conversations, that's one of the most critical pieces because you can give a lot of like you want to believe what's being told to you. You want to believe the product is going to be all the things, but you want to hear the hard stuff. You want to hear where that piece was. And ultimately, I think for us that journey included that openness to I don't know if they're going to go with us, but you can talk to them. And at that point, they really didn't know where they were going to go. And so for us, I think it was a really helpful and fruitful conversation. I think honesty is a really important part. I think you have to be you really do need to go through that process. I know like sitting down to our first reference, you don't know what to ask. You don't know what you're kind of just grappling with this new idea. By the end of all of this and through all the questions, I feel like you get better and better at asking different questions. But I do think that journey helped us land ultimately with Elios, who we've been just very happy with.
That's great to hear. Yeah, one piece just to reinforce for the audience is that peership in this process. Um, it's not unlike any other technology adoption or any other like decision you might be making as an organization. And we hope that, National Council and other organizations are creating spaces for you all to connect in those ways. But with something like AI, which like every month is changing, right? It's just evolving at such a rapid pace. Um, I think it can be a little extra daunting, right? It's a little, this is still relative. It's not new. I mean, artificial intelligence technologies have been around for decades, but it hit a new pivot with the GPT-3 and sort of like the last 2, 3 years. So it is relatively new, I think, in the just general sphere of society. So from that regard, having peers and folks who have been through it, who are going through it, Nikki, as you said, folks who went through it and didn't have good experiences and things like that, like all really valuable. So I love that. Jim, what about for y'all? What was that process like?
Well, I'll add a couple of things. Nikki covered so many good ones. From the beginning, we knew we had IT involved in the kind of the review, and so if you're someone coming from a clinical background or administrative background and not technical, that really helped us. Certainly, being able to just work through those technical aspects. Um, we did know I very similarly. I think to what you said, Nikki. Elios promoted to us, and I think had continued to come back to us once we even signed on with them with this question of where's your next pain point? What can we do? Like they were looking at the provider organizations to help determine what do we tackle next. It wasn't sort of like, oh, we've decided we're going to add this feature or we're going to do this. They were really, it was almost like this is for us. So please tell us where your next pain point is so that we can devote our resources on the most meaningful impact for you. Now that's obviously after we made the decision, but I think that um, that kind of philosophy and that sort of earnest concern for how do we improve the work life of mental health clinicians really kind of showed through for us at the beginning. We also had some relationships with some of the staff that had been with other organizations that we had known. So sales wise, so that was for us in addition to the usual just kind of research, checking references and due diligence processes.
Yeah, well, I'm glad you brought up your IT staff. Of course, that's a key to any technology adoption here, and I know Nikki, you all involved your staff in that regard as well. Um, Again, we won't get into it today, and I don't think any of us are going to claim to be any technology experts, and we'll leave it to our colleagues. But I will just flag, in our last webinar in this webinar series, we did have some of those experts on, so be sure to check it out. And when it comes to questions around data and data security, those are really big questions to ask folks, right? And so I would say lean in and ask all the questions, right? Here is definitely not a time to be shy. And one of the things, again, we covered it on the webinar, but and Nikki and Jim do chime in if you have thoughts here. One, I think some of the more challenging parts is knowing what a good response is. So like you can ask, what are you doing with my data? How are you using this or are you using any of my data to train your model, et cetera, et cetera? But what would a good response even be? I know I would not have known that. So it's a learning curve for sure here, folks. And so, try and read up. I see some comments around, can we get some guidance on vendor questions and things like that? The National Council is looking at it, as are others as well. We'll try and share some resources in that regard. I don't know, Jim or Nikki, if you have anything else to add on just like this like tech validation piece, but it's key. At the very least, you got to have your technology team side by side.
Yeah, other than that, I don't really have the tech background to get too deeper than that, but you have to have it, absolutely.
Outside of the AI for specifically for behavioral health or clinical services, I think you both are using it in other ways as well. And again, this is a key because I want to just tell folks on the line, if you aren't aware of whether or not your staff are using AI, yes. Yes, right. It's happening. And to some extent they should be, right? If it's everything from taking notes on a meeting to, helping to write non-clinical emails to brainstorming or writing job descriptions, right? There's things to lean on here. But we also just don't want to open up the floodgates and say you can just sort of do whatever you want. So let's talk a little bit about governance.
Mhm.
Jim, I think you mentioned that you guys were working on a governance plan. Nikki, I'm not sure where you guys were at, but tell us a little bit about that AI governance journey that you all went on, because that's so key here. So, Jim, maybe you want to start?
Sure, and it's exactly as you said. They are using it, and the biggest concern is a staff person using a product that uh, causes a PHI, release issue, or releases something on behalf of the agency that really wasn't properly vetted, or any of those sorts of things. So yeah, our governance policy is pretty clear. We have only a handful of agency approved AI tools, so Gemini, Elios, a few of our other Workday, things like that have elements to that. So we make it very clear again that these are the only tools allowed. So we're not using Chat GPT or other things like that, just for those for the employees. Um, and then I think just one kind of key point is that we also discussed and emphasized that things always have to have the human eye and it has to be reviewed. It can never just be, whether that's obviously a clinical note or a letter to a community partner or whatever it may be, like it's a tool to get you to maybe refine or to assist you getting over a hump in the process or a design challenge, but it is never the last touch on a document or a product. So that's a real quick overview. But Nikki, what you probably have some other things.
No, I mean you're right on as far as the governance and really determining as an organization what you're going to allow or not allow. And again, for us, it's been more recent, and so we did have like we knew that I learned more. I figured there was tools being used, but when we started going down this pathway, it ended up really highlighting how many different tools. Like some people were investing in some tools personally, some were using. So really quickly became a like, oh no, we need to really think about this because it's happening and it's happening in ways that we're not able to control. And one of the things that I think was a big aha moment for me was like we had, like those innocent, the first when it first started coming through, where it's like, here's some notes from your last meeting. Do you want to read them? And you could click it, and then they wanted all this information for you. And I remember the first time I was like, well, yeah, I want the information. And then it was blocked because our IT is smarter than me. And I was like, why can't I read these notes? And they said, well, once you do that, it'll activate it on your system, on your teams. And so I did not know that. And what I started to see, which I think is scary, is some notes come through from other meetings with other people with client information on it. Even like you couldn't see all of it, but you just got the little snippet. And I could see PHI being emailed out to everyone on the calendar, not just people who were participating, but anyone on the calendar who had that invite. If that AI note taker was in the room, it was blasting it out to everybody. So as an organization, like our IT was really on top of it, but the part that was really critical for me and our teams was to communicate what was going on, to really be able to say, hey, those note takers in that room, you need to watch what you say in those meetings because it might not be your note taker. But you need to check that room you're in and see if there is a note taker. You cannot disclose PHI because that information is being recorded and can be sent out in ways that you don't expect. So it really shifted the conversation, not just like on the offense about like what tools do we want to use, what supports do we want to have for staff, to a defensive move, to a like you need to be prepared. You need to look in that room. You need to ask that an AI to note taker be removed if you want to have real conversations that include some PHI with the right releases in place and things like that. So for us and for me, it was eye-opening to shift from this cool, these are tools that are helpful to like, whoa, you got to watch because this information can be shared in ways you don't expect. So thinking about governance in that way, not just in the like what are the things we're using, but also in the ways that we expect staff to act when they are in spaces where these tools might be used and they weren't the initiator for that.
Yeah, yeah. I expect. I mean, already I've been in. I'm sure others on the line have as well. I've been in meetings where folks, ask everyone to kick out their, note takers, right? Where or they ask from. So I think we are going to start to see some behavior change in norms in that regard. But it's at the end of the day. I mean, there was a comment. I'm trying to keep up with some of the comments as well. There was a comment around, you know, at the end of the day, something about like who's like point is the organizations, the clinicians and providers, you all are still at like this is still on you, right? This is still you are liable. And I will say last we did a webinar series last fall, and the last one in that, and just sort of trying to leave some resources for folks, we had some legal counsel on, and they were talking about liability in this space. Liability still exists there just because you have these tools. And so you really need to step up your game, Nikki, as you said, into what that means. And Jim and Nikki both had governance points there, or governance pieces in place, and that's so important. So I think maybe two more questions, and then we'll try, or maybe two to one more questions, and we'll try and open up for Q&A. Where are you all going now? I mean, Nikki, you mentioned compliance is something that you all are interested in. Maybe there's other spaces as well. Jim, what about for you all? Like, what are you hearing? What's exciting you? Anything that you guys are thinking might be your next step in this journey?
Yeah, we've looked at the compliance tool as well. There's some certainly some really great potential for that. I think for us right now, we are in kind of evaluating and probably not making any major decisions. Some of that has to do with the federal and the state climate with budgets. So that certainly is an impact. I think probably more globally is just seeing the products out there that are able to take all of the data from all of our systems and kind of the data management and the processing that I saw. I don't want to go too far into things that I'm not really all that clear on, but it's just pretty amazing what is able to be done. And I think that's kind of what I'm thinking about right now.
Love that. Nikki?
So obviously we're on the compliance journey. I think for us, state of Kentucky started doing PAs, prior authorizations with managed care organizations went back into effect in June. And so we that alone, there's just so much that has happened on the scrutiny and the documentation. And what we know is obviously there's that piece of like you sample and you look and you don't see everything. And so really shifting into a space, or the natural next step for us was shifting into the compliance space, because we know managed care organizations are going to be using AI. Some are using AI to scan our records. We need to be, anything that we submit, we need to be on the offensive of that. We want to ensure that our records are being looked at from a holistic perspective. And so for us, the compliance tool is an important one. Also, as far as it connects to like staff needs for UN, like having a person versus having something automate some of the compliance checks was important. So that was an important one. I think where we're interested in there are some really interesting tools on the ways in which you can do like front end work with individuals, to start gathering the intake, making the intake process better, that initial gather of information. It's still painful no matter what, because there's just so much information that we ask for, that if there was a more organic way to do that, I know there's some tools that do really manage that in more of a chat function that can kind of synthesize information for the clinician to prepare them for. So I think we're interested in seeing where things can go on the intake side of things. And we're looking at deepening our ways in which we can ease documentation. So documentation can be progress notes about treatment plans, assessments, notes. We have intellectual developmental disability notes. We have, that are different than our psychiatry notes and our clinical notes. And so there are some other pieces in that clinical documentation we're looking at as well.
That's great. Thank you.
Jeremy,
Jim,
can I quick jump in? I totally, my brain went to the global, and then I was listening to Nikki and I thought, oh my gosh, I completely glossed over. We are working and very excited about a module for psychiatric outpatient, which we're helping to kind of develop and pilot that. We've moved into psych rehab, some of those types of programs and community-based programs, and also considering the possibility of what will be available to assist with group documentation as well. So but again, all of those things are just kind of, or the group particularly is a consideration. It's a future possibility for us.
Yeah, no, I appreciate that. And I'm looking at the questions here. I have one more question for Nikki and Jim, sort of a wrap up question, but let's look at the questions from audience here, and audience keep them coming in, because a lot of folks are asking about use cases and are curious about it. So let's just quickly sort of speak to some of these. So the compliance tool that Nikki mentioned, again, Nikki, is it fair to say that this is a tool that's looking at all of your documentation, scanning it, ensuring proper documentation and validity such that it would help avoid any kind of issues in the submitting of documentation and the kickbacks and the denials?
Yes. So the tool that we're going to be implementing at the current stage, it essentially will scan mostly on the progress note side of things, and the treatment plan are the two pieces. And then they're looking at the golden thread, they're looking at duplication, they're looking for empty. So there's pieces that are automatically built, and then there's some customization we can build in to kind of scan notes essentially. The piece that's coming is it will be able to, in live time, kind of alert if you're missing something, a key piece to what the compliance piece is. So while you're ready to submit your note, before you do, it'll be like, wait, hold on. So that version is coming, but yes, it's intended like each night to kind of do that scan and it can give us a temperature check of like by clinician, by case manager, and also by notes. So it gives that from a minute and a more global perspective to help us identify like how are we doing, how are we meeting that criteria for it to help in that process.
And folks, you hear like this has nothing to do with the quality of delivery of care, right? I mean, this isn't changing the way this is just sort of making it easier and in sort of checks and balances to the documentation side of things to protect the organization, protect the clinician or the provider, I should say. So that's great. Jim?
And also taking a lot of staff time off of the manual process of checking those documents. I mean, that's really the other big sale. And I think some people were wondering if that's also an Elios product. And Nikki, it is the same.
Yeah. Yeah, and there's some other spaces too. So Jim and Nikki, you all mentioned there are companies looking at everything from assessments to treatment planning to intake processes. Again, really think about the spaces in which there's those like heavy process burdens. There's a lot of talking happening, and digesting all the information takes time. This is what AI is really good at doing. So we're seeing a lot of the technologies in those spaces, and just looking at the questions here, we are. I would also say that there's a lot of folks now looking at training as well. How do we leverage AI for workforce training, helping folks practice the delivery of services in simulation settings, safer settings, so we can get used to different care delivery opportunities. Question about government regulations that you need to be aware of prior to implementing AI. The short answer is yes. Let me just ask Jim and Nikki, like, have you all come across this yet? It's a pretty evolving thing of there are regulations, there are state-specific regulations. The federal administration feels differently about some of that as well. Have you guys encountered any of that yet, or not quite?
I'll
State
start. I don't.
regulations, yeah.
Yeah, I mean, we've had in the early stages, we did have some conversations to kind of confirm that it was okay. We didn't go deeply into that, and we haven't had any, as far as I'm aware, any kind of pushback at either of those levels on regulations.
Yeah, and I'll just say, like, we have a lawyer that we use periodically for things, and we absolutely used our lawyer a lot, both in the contracting side for the legal piece. I mean, the bottom line really is it's the Wild West, is that's what they're really saying, and there's nothing that is really impacts what we were trying to do. It was more about how do we build something that doesn't have those pieces in place, and so we absolutely consulted legal, and then had to really rely on kind of as we vetted the process, making sure we were putting it into a way in which we were able to protect as much as possible.
That's great. I'm at least personally aware the states of Illinois and Utah do have legislation regulations in place prohibiting specific uses of artificial intelligence in behavioral health services. For example, in Utah, it's more around chatbots and their use. But the point is, make sure you're keeping an eye on what's happening. And right now, it's mostly happening at the state level, the regulatory space. A whole separate conversation would be around what is the need for and how do we get to best practices in the regulation of AI and behavioral health. It's a really important and interesting conversation. We don't have time for it today. So I'll just leave folks with make sure you're keeping an eye on certainly state level, and then eventually we may see federal regulations. And in lieu of that, ask the vendors that you're working with or talking to questions about their certifications, questions about how they ensure against things like bias in the data that they're using to build these models, how they are adhering to best practices and HIPAA compliance and high trust compliance with data privacy, things like that. Let's see. Other questions for our panelists here. So a lot of good questions, folks, about like the state of AI. So those are good. If you have specific questions for Nikki and Jim around implementation, let's take this one real quick, and maybe this will be one of our last ones before I turn it over to our wrap up question. Let's talk about ROI again, because one of the things that is I think important to keep in mind is that some of these technologies may be more cost prohibitive than others. And we're obviously talking about a lot of technologies at this point. Maybe someday in the future, we'll see a lot of consolidation and you're buying one product that does 75 things. But right now, it's a little bit more fragmented. So let's talk about ROI. And you can talk about ROI probably from the impact of your services you're able to deliver, quality there, your staff, and then maybe like an organization. How would you all frame up ROI for your organizations?
I mean, for us, I feel like a lot of the way I would look at it is kind of like I kind of talked before about the environment you create that allows people to thrive. I think like not just in the level of direct productivity, but when we talk about the impact of retention, the cost to hire, the cost to train, the time it takes, and in the natural turnover, like for every time a clinician leaves, there's clients who won't come back. And so I think that's where building that environment is such a critical piece. There are other pieces that automatically kind of come into play, and I think it has more to do with like there is a fact around like the cost of staff. So like when we talk about our compliance tool and that manual versus what becomes automated does mean there is some streamlining that can happen and some cost savings that can come out from that as well. I also think that there's kind of an unknown element to it that I think is a natural benefit, which is that ability for in situations where a tool is being used for note taking for a clinical exchange. I think somebody who's more present is more likely to engage somebody more meaningfully, is more likely to have that person come back in the room. And so I think the unknown amount is like that retention of clients as well, just from that interaction being different. Because I know the difference when I'm sitting and just having a conversation and when I'm trying to take a few notes and make sure I'm catching everything that is being done. It's a very different type of interaction. And I do think that there is an unknown a benefit is hard to quantify because it's the people who continue to come back who may not have come back. So on that level, so investing in these tools, I do think there are some components to think about that will be directly to your revenue, and others that are the kind of like impact it, but in ways that are not as direct.
Wow.
Yeah, I love
Great
that,
answer.
Jim.
I'll just add with the tracking of kind of our metrics on time to complete notes, completion of notes, we definitely can see, again, now, does that equate to necessarily equal numbers of increased productive units? I'm not going to say that, but we do see that we have much more time, more efficiency. Our clinicians have that availability that could be used for, and even if it isn't used for a billable unit, to Nikki's point, maybe they're then leaving on time, or they're able to take care of themselves, or do something else that's really important and results in a retention that, and when we all, that's the worst thing. It impacts so many consumers, the cost of it, and it's so I think probably just looking at it from that perspective as well is really where we're looking at the ROI for this.
Yeah. Yeah. Again, everything that I'm seeing in the tools, technologies that are here today are being developed in the near future. Folks that are developing them are really thinking about the people part of this and how they're making it easier for the people part, knowing that, and some of these are directly about improving, care and helping, like whether it's decision support, clinical decision support tools, things like that. But a lot of this is just about if you can make it easier, if you can, focus on the work-life balance, as Jim said, if you can focus on just like somebody being able to pay better attention, be more present with their clients, like the impact clinically, outcomes, financially, like it all sort of ripples down from there. So I know we have a minute left, so maybe just real quick, 30 seconds. This was my last question, was just like any like major last piece of advice for the audience as they either begin or continue their AI journey. Nikki?
So my biggest piece of advice is that making no decision is a decision. You got to do like you have to make a decision. And I do think it's every journey is different. I know Jim and I talked about Elios, but I think finding out for your organization what fits for you is important and not sitting and waiting. It's time to figure out how your organization needs and potentially would need to move forward to make sure that you're keeping up with where the future is going and figure out how that fits into your world.
That's excellent. And I'll then use a little more of a staff specific or a kind of a micro comment that I think people often focus on what they're giving up, and but the way we're doing it, we're used to it. And I think we aren't going to promise people that the new way is going to be perfect. So you have to watch out for that. But I think just reminding people that the old way isn't perfect either, or the current way isn't perfect. It has all of there's biases and there's inefficiencies. It's just you're accustomed to it. And so just kind of moving people along in that change continuum of we're moving to something that's going to improve things, even though it is a little scary or different.
Love both those sentiments. Nikki and Jim, thank you both so much for your time today, for sharing your insights and experiences. Thank you all for attending this webinar. I hope it was insightful and educational for you. Again, recording will be on our website soon, and everyone have a great rest of your day and week.
Thank you.
Thank you very much.
Thanks, everyone.